Back, everybody. We're going to go ahead and get started with our next session. And I have the great honor of introducing our next two speakers. And these are two of my favorite gentlemen in the world. And if they are not two of your favorite gentlemen yet, you just wait till the end of the weekend, and I bet that you have the same high opinion I do. Our next topic is weight bias, changing public perception starts with me. And Ted Kyle and Joe Nadglowski are the presenters. Ted is a pharmacist who collaborates with leading health and obesity experts for sound policy and innovation to address the obesity epidemic in North America. He is also an accomplished healthcare marketing and innovation professional. Ted is a member of the OAC National Board of Directors, currently serving as vice chair, will be taking over as chair come January 1. He is also chair of the Obesity Society's Advocacy Committee. You may have already seen and heard Joe speak a couple of times throughout the conference already. Joe is our president and CEO of the Obesity Action Coalition. He has led it since the foundation in 2005. Joe is both a national speaker on the importance of obesity awareness and an expert in advocating for obesity rights. He has been a guest of First Lady Michelle Obama at the White House to discuss childhood obesity and has testified before the FDA on the importance of increasing treatment options for individuals affected by obesity. Please help me welcome Joe Nadglowski and Ted Kyle to the stage.
Thank you, Pam. So Ted will come up in a little while, but I have the privilege of starting. And today we're going to talk about weight bias, and it's a little bit odd. I give this talk a lot. I give this talk to healthcare professionals, to drug companies, to hospitals, and I talk about the prevalence and the wide amount of bias that we see. Many of you in this audience have experienced this firsthand, but the interesting thing is today I'm going to show you the data. So it's not just, some people will say, well, you can't prove that. That's not really true. And I say, well, know what? We have data around it. And I won't bore you with lots and lots of data, but it is a very interesting set of information that is out there on this topic. And I think the challenge that we face on this obesity issue is that obesity, we all agree obesity is bad. But people with obesity should not be considered bad as well. If we were talking about cancer, we would all agree that cancer is bad. And we would have compassion for those who struggle with cancer. But in our society today, the same does not apply with obesity. People with obesity are perceived as being bad. And it is a real challenge. So the talk today is going to talk about what is weight bias, why does it matter, and how can I change things. All right, this is very fundamental. We've heard bias come up already in one of the talks this morning. If any of you attended the member mingle last night, you heard Dr. Buchwald mentioning prejudice. We use different words. You may hear prejudice, bias, discrimination, stigma. We're all talking about the same thing when we use that kind of language. And so what is bias? It's really those negative stereotypes. It can be things that lead to stigma, rejection, prejudice, and discrimination. But it can come in different forms. It can be verbal, it can be physical, it can be relational, and in today's day and age, it can be cyber as well. And it can be subtle or it can be overt. I will also say that sometimes it is intentional, and sometimes it is unintentional, and we have to acknowledge that as we move forward. Whenever I see this slide and I present this, it reminds me of just kind of where we are when it comes to this issue. Is if we talk about the conversation in this country we're having right now with our children about bullying. Okay, bullying is a national topic. It's drawing attention across the country. Now, the original form of bullying, or child-based bullying, is weight-based bullying, right? But I challenge you, if any of you have young children like I do, when you go home, read the bullying materials the schools have sent home. There's nothing in them mentioned about weight. It is so accepted in our culture that people should be able to be stigmatized or discriminated against based on their weight that even a national bullying effort does not include that information. And that troubles me, and it is a real opportunity for advocacy, which many of you know is my other passion as well. And so it really does come forward in every part of life. And I'm going to show you all the different places you can see it. You see a list of them here. We'll just hit some of the highlights. And so let's roll right into this. Oh, before we roll into the different topics, let's look at the prevalence. Okay? I think it's very interesting when you look at data. This is an odd slide. We're comparing discrimination. And that, to me, is a little off that you do that. But the reality is all discrimination is wrong. But we wanted to see what the prevalence of weight-based discrimination is. And I think what you'll see in this, and we've heard a talk about how obesity, the impact on women this morning in different parts of their life cycle, we see that the discrimination factor also seems to largely apply to women as well. But what this slide basically shows is that weight-based discrimination is actually the second most common form of discrimination only to gender itself. So being a woman yourself, it's most likely as a woman, that's the second most likely form of discrimination you might experience. And so we asked the question, is this a new effect? And our friends at the Yale Rudd Center and Dr. Rebecca Poole, who helped me put the slides together, looked at this going back 10 years and looking at the data. And you can actually see here, and basically this shows how dramatically weight-based discrimination is actually increasing. It is now becoming more and more common. It's actually the most common form or the fastest growing form of discrimination. So again, shows that it is a real problem and especially affecting women, which is troublesome for many of the other reasons that we saw earlier today. And so when we look at our media and why we have weight bias, I'm going to argue that our media reinforces weight bias in many ways, shapes, and forms, and I'm going to show you some of the ways. Some of the ways you'll agree with 100%. Some of the ways you may think, well, is that bias or not? And I just want to challenge you just to think about some of these issues. So I think we'd all agree that if we look at the media, people are stereotypically portrayed if they struggle with obesity. They may be abundant, but they're not going to be the central character. We see lots of reinforcement of the social acceptability of bias. And I do believe the data is very clear that if someone sees bias in the media, they're then more likely to engage in bias themselves. And so let's look at one specific category. Mr. Eddie Murphy has made a fortune in this space, portraying characters wearing the so-called fat suit or empathy suit, depending on which viewpoint you have on those. But really, there's a whole collection of media products, Biggest Loser is an example, that actually focuses on those with severe obesity. And many of these, for those of you who watch, know that I have a love-hate relationships with a lot of these programs. At times, I see wonderful breakthroughs around the complexity of the issues and the redemption and the opportunity for people to make changes and to improve their health and lives. And then others I see, tremendous bullying and what I consider hate. I mean, we saw, for example, The Biggest Loser, have segments with children on it now. And they did this wonderful segment on childhood bullying. I thought it was a wonderful segment, kind of digging into the issues. And then it flashes back to the ranch. And suddenly, they're the trainers bullying the people who were there who were adults. I'm like, come on, can't you get the message that this is a complicated issue? And then if we actually look at TV, and again, I'm telling you this not on my opinion, but based on studies. Okay, they actually study this, and it really does add to the scientific validity of this, that we see few characters with obesity on television, and they're always in these stereotypical roles. And I think a lot of you have seen these words or experienced these words before. It is what the reality of what we see. And there are very few positive social interactions or romantic relationships. So another one of those shows I have an interesting kind of love-hate relationship is with Mike and Molly, okay, featuring two characters who struggle with obesity engaged in a romantic relationship. When they started engaging in their romantic relationship, hundreds, if not thousands of people actually wrote the network saying they did not want to see two people who struggled with their weight engaged in a romantic relationship. And I'm like, are you telling me that people took the time to write a television network about fictional characters on a TV program, which is one of 400 channels you can watch on any given night, and you took the time to write that note? But the reality is that's what happened. Now, the network ignored it and continued to move forward, so therefore, I applaud them for doing that. And I will tell you that the research does show that this media adds to bias. And we know that if you see it on TV, you see it on films, you see it in fashion magazines, you see it in video games, you are more likely to engage in bias yourself. So, now, I talked about kind of TV. So let's talk about our friends from the news media, and I apologize to any that are in the room, because I know there are some here today. But the folks in the news media also, whether intentionally or unintentionally, do this as well. And there's been some very interesting studies that have come out around this, and I will tell you right now that if you went and Googled obesity, you went to Google News and hit obesity, I guarantee you'd find one of these 9 images in the top 50 stories on obesity. These are the most common images you would see to depict obesity in this country. People being sedentary, eating poor quality foods, focused on a specific body part, and almost always lacking a head, okay? Look, I've always had a head, no matter what weight I've been. People deserve a head. We're going to talk more about that in a little while. All right, so this is actually a study where they actually looked at online news stories and the images associated with it. And you will see in this study, and I'll walk on the other side to highlight this box as well, because I know I'm hanging out over here, is that if you are overweight or affected by obesity, there was a 59% chance that you would be depicted as headless if there was a picture of a person there. Look at what it was if they were considered so-called normal weight, okay, non-overweight. Only 6%. So you see here 59% and then 6%. The other thing I will say that when you look at the story is how people are depicted as being dressed. Only 11% of people who were affected by obesity were shown as being in professional clothing, while more than 50% of people who were considered so-called normal weight were shown in professional clothing. I will tell you that even when I was heavier and I was talking in front of you, I'd be wearing a suit. I would be in professional clothing. Why wouldn't we show that in the news media? We see it over and over again. And in fact, the studies actually show that 72% of images stigmatize people who struggle with obesity. And actually, even in video, we see the same trend in video. Look, it's a little harder to cut somebody's head off on video unless you're doing it by accident when you're shooting video. But the reality is that 65% of the videos did that as well. And again, stigmatizing images worsen public attitudes. Non-stigmatizing images improve attitudes. And you know what? The public's tired of it. They want positive, non-stigmatizing images. You know, my other passion is advocacy, and one of the things we've seen of interest late is that weight and obesity has entered our media, and bias, in my opinion, has entered our media. And this is not to comment on Governor Christie's politics, because I don't do that, but what I'm saying is I know for a fact that someone's size or weight does not have any influence on their ability to lead this country. To me, that is bias. And you see so much of it when it comes to the story. The questions are all about weight and not necessarily about qualifications. I will say one thing around this issue, and that is I saw what I considered a positive change in this space not long ago, and that is when Governor Christie chose to address his obesity and go public with his treatment. The one thing I noticed was I saw not one person or one pundit or whatever it may be say, this is a man who didn't need treatment. He should have gone on my diet or my exercise program, whatever. They didn't say it. Now, they might have said he should have had a different procedure or whatever it may have been. But they actually said, look, this is someone who needed help and he deserved having help. That wasn't the criticism of that. So I thought that was a positive when it comes to seeing changes. But remember, there are a lot of people who are like Governor Christie, who are in his same shoes, who have no access to the therapy that he had access to. And that's one of the things OAC, of course, strives to change. We see this in the workplace. I know many of you know this, but the data is very, very clear around those affected by obesity being hired less often, facing outright prejudice and discrimination, getting paid less, especially women getting paid less, and being fired more often, et cetera. Oops. Obviously, and I think this is information that I don't think is new to you, but the data is clear that job candidates with their obesity are less likely to be hired, assigned a lower salary, considered a poor fit, and they're evaluated less favorably. And in fact, with women at extremely high rates, you're talking close to 50% of women reporting that they actually face prejudice and from both their employers and from their coworkers. And remember, this starts at just overweight. We're not talking obesity, we're not talking severe obesity. It starts at very low levels, especially with women, that they are reporting outright workplace discrimination. And then we see it in our healthcare community. And this is an interesting challenge because the folks that are supposed to be there to help us on this journey often too engage in bias. And we see it, and again, no offense to those in the room, because I know if you're here, you're committed, and I know it's not everybody. I don't mean to paint everyone with the same brush, just like I don't paint every employer with the same brush, et cetera. But we know that we see bias in physicians, nurses, medical students, dietitians, fitness professionals, et cetera. The simple reality is that they think the issue is very simple when we know, and I think one of the things OAC is very strong on is that obesity is a very complex issue. And you see those same things we saw, by the way, in television, reported as the common attributes. You see providers saying that people are that way as well, that they're non-compliant, they lack self-control, they're unsuccessful, they're dishonest. The reality is that's how many people perceive. Now, why is this? I mean, part of this is driven by the fact that we have a great deal of lack of education around obesity in training our healthcare professionals. That is starting to change, too slow in my opinion, but it is starting to change. I think over time, and we're starting to see trends on this, and I don't know if maybe Ted and I can talk about this in the Q&A, but we're working on a study where we see physicians are starting suddenly to get it better, that they understand that obesity is actually a really complex issue, and it may be more genetics, complexity, environment that is the primary cause, and not this somehow the person is a bad person or somehow is engaged in what's considered a personal failing. Here are the physician terms. The thing that stands out to me on this slide is how physicians view is the second bullet point, and the second bullet point under the second bullet point, and that is they have less desire to help the patient. If you have somebody who presents to you who is arguably one of the most medically complex people, why would you have less desire? It may be frustration on the lack of therapies that have been available or lack of options that they can refer to, but it truly troubles me when we see that. And we see it with nurses as well. With nurses, is a lot of it driven by the fact that many of them didn't have the tools necessary to help move people and care for people as hospitals and medical facilities got ramped up to take care of folks of different sizes. But what shocked me on this one is, again, down at the bottom, 24% of nurses in this survey agreed that people with obesity repulsed them. Repulsed them. Can you imagine what a nurse sees on a daily basis? And we're saying this obesity is what repulses them? That really, really, really bothers me, and I imagine it bothers you as well. And then we see it in education, and we know, as I mentioned earlier, that there's such a harassment and bullying from students, from teachers. We see false and low expectations from teachers. We see barriers to opportunities. There are studies that show that kids with equal grades, yet one is normal weight and one is overweight or affected by obesity, that those with the so-called normal weight are admitted to college at a higher rate, even though they have the same grades. Well, why is that? Well, let's be honest with you. If any of you apply to college, you either go for a personal interview or you send a photo. That's part of the normal practice. And is it that kind of bias that is driving that? And I think you see, and here's the specific information about that. And if you look at these things, it happens over and over and again. And I think one of the most troubling things happened just recently. And this was a psychology professor who tweeted, "Dear obese PhD applicants, if you don't have the willpower to stop eating carbs, you won't have the willpower to do a dissertation. #truth." And so he was, after quite an outcry, both by our organization, our members, and many others. What we're finally seeing is others are rising up to take on this fight with us. I was disciplined for breaches of ethics. He was banned from any admission committees. And last I heard, he's been actually asked to write a new policy. a new policy making sure this kind of language and thing doesn't happen in the past. I don't necessarily know that he's the best candidate to do that, but some people can learn from those experiences. Now, before I invite up Ted to take on the next section, I want to talk a little bit about whether bias is intentional or unintentional. I know many people, and I have the privilege oftentimes to act on behalf of the membership of OAC and call someone who we believe is engaged in bias. And many times when I talk to them, they tell me what I was trying to do was motivate people to do something about their weight. It was a well-intentioned, but what they didn't get is by engaging in that activity, they're actually having the opposite effect. You know, people who experience bias are more likely they're not going to turn around and suddenly address it the next day. In fact, they're much more likely to go home and continue to engage in even worse behaviors that might have contributed to their obesity. The response to the stress, we saw information about stress earlier, is what's the response to stress? You eat more. Food is a comfort. 80% of women turn to food after stressful situations. And so I think we have to keep that in mind, and we have to educate folks specifically around that topic, around, look, what you're saying. You know, I had a hospital executive tell me, I'm not going to hire anyone with a BMI over 35. He goes, we're on a health and wellness kick here at the hospital. We have great obesity treatment programs for the public. And I said, so you're going to invite the public who needs help and has a BMI over 35, but you don't want them to see anyone that looks like them and may have experienced what they have experienced in your hospital. And he stopped and he said, then he understood. He said, you know what? He goes, my intent was to help people, but I realized I'm actually hurting people by doing this. And he wrote an apology letter to his employees at the hospital. And then we moved forward. And I think that is what we need to do more of, is recognize that there are times, look, I've been on CNN and I've seen the comments written on those horrible things, and share your story, remind people. There are some people that we're never going to change their minds about on this topic. But there are people who, if you have a rational conversation with them, you can turn that story into one where they become an advocate. I had another hospital executive did something very similar, and in the end, he said, Joe, after I talked to you, he went through this process. He goes, if there's anything I can ever do to help you in this process, let me know. And so we turned someone who was perceived as an enemy into an advocate for the cause. And I challenge you to do that as well. So now I'm going to invite up my very dear friend, Ted Kyle, and he's going to talk more about why weight bias matters.
Now I need to know what all these buttons are for.
All right. This one advances the slides. This is my laser pointer. If you have your own.
So this is a pointer, and this advances the slides.
Yes, sir.
Okay, got it. Well, thank you so much, Joe. And your story about people who seemingly have good intentions and use weight bias as they rationalize it to themselves as they're just trying to help, reminds me of a 104-year-old gentleman who told me after I wrote an item for our church newsletter that I was doing the young people of our church a real disservice by letting them off the hook, and that he has granddaughters and he's going to tell them that they better not get fat. And I was telling a friend of mine who works on a lot of these projects with me about that, and he said, yeah, that's just the kind of grandfather you want. So that is common, and that's a rationalization that people use, but I want to talk a little bit about why that matters and how that is false. And so, this is really my bottom line. Weight bias matters because it's no different from any other form of bigotry, and that's what it is. Let's call it what it is. It's a violation of human dignity. It's a way of dehumanizing people, turning a person into an object instead of a living, breathing human being. And I think most important of all, it's a waste of human potential. That hospital executive that went off on this tangent of saying, I'm not going to hire people, that is wasted talent in his organization. When somebody tells employees, which I think happens all too often, we'll promote you if you can lose some weight. We get those calls at OAC. I hear about them. You're wasting the talent in your organization. How stupid is that? And most important, it's a barrier to overcoming obesity, and I'm going to explain a little bit more about that in just a second. And then we're going to have some time at the end for Q&A, because you guys are really kind of experts on this subject. Weight bias has far-reaching effects, and that's another reason why it is so important. It has an effect of keeping people with obesity from seeking health. There's been research done on this. People avoid health appointments because of the judgments that they experience in healthcare. It has the effect of keeping professionals from offering help, and Joe talked about that a little bit. It's the last socially acceptable form of discrimination. That 104-year-old gentleman still runs into me, and I don't get into the argument. I mean, he's 104 years old. I give him some space. And he says, I'm still going to remind my children, my grandchildren, and he thinks he's doing a good thing. It makes obesity initiatives ineffective because weight bias lies underneath a lot of decisions that are being made and gets in the way of rational decision-making about obesity. People who are making policy occasionally, not with bad intentions, but because that bias is at work, they say, well, we can't do this. We can't give people unfettered access to treatment because that would let them off the hook. What part of that makes sense? When do we ever talk about anybody with any other health condition getting off the hook by getting it treated? And so that's how it helps to erect barriers to treatment access. Recognizing and combating bias, both our own, because even people who struggle with obesity harbor their biases about it, and the bias from others is absolutely critical to defeating obesity. And I have the privilege of getting to know some real experts in weight bias, and it's one of the greatest learnings for me of the last 5 years. Well, another reason why it matters is just dollars and cents. Looking at the wage penalties that people suffer because of weight bias, it's a particular penalty for women. You see here, overall, in an examination of 12,000 people followed through 15 years, 6% lower wages just because of bias, independent of their talent and what they have to offer. 3% lower for men. And it makes health worse. We've been talking about that, but there is extensive research. There was just a study that was published in the New York Times recently about how healthcare providers, doctors, show less empathy toward patients with excess weight. They spend less time in appointments with patients that have obesity. They discuss less with patients. They offer less empathy. They assign more negative symptoms to those patients. They perform certain screenings less, and I'll talk about that in just a second, and offer less treatment, which compounds the problems that obesity brings in terms of health. Patients with obesity often get less preventative services and less exams, fewer cancer screenings, fewer pelvic exams, fewer mammograms, and as a result of this kind of treatment, people with obesity, looking across the population, more often cancel appointments, delay appointments, avoid that unpleasant experience in preventative care. And this was a quote that really stuck out to me in that article on empathetic responses of doctors. You could walk in with an axe sticking out of your head, and they'd tell you your head hurt because you were fat. I've talked to a few people who've read that article, and I would encourage you, I actually am somewhat heartened when you look at the responses to articles like this lately. I'd say 3 or 4 years ago, if you read reader responses to stuff about weight bias. The hate index was probably at 60 or 70 or 80%. And when I looked at the responses to some of the publications lately, it's way down there, and it's more like, yeah, you know, this is a real problem. This is ridiculous. And I am hopeful that people are starting to get it. So this is what I would call the cycle of weight bias, where people with obesity experience an impact on their health from obesity. They seek health care. We experience weight bias in that health care setting. And so what's the natural response? Well, one perfectly reasonable response, I would say, is look for a different health care provider. But all too often, it's avoidance of health care, which leads to unhealthy behaviors and a compounding of the problem of obesity. Most recently, in the last month, there was a good study done which I think brings this all together, and that is, I think, the observation that using shame and blame, as Joe referred to, against obesity is nothing but a lie and a false rationalization. As he said, some rationalize weight bias and stigma as a source of motivation for a healthy weight. But what these researchers did was they looked at a population of people who experienced weight-based discrimination, and they found that people who did not have obesity, who experienced weight-based discrimination, had double the risk of developing obesity of someone who did not. And people who already had obesity, who experienced weight-based discrimination, had triple the risk of still having obesity later in life as someone who had obesity and did not experience that discrimination. And I think that brings me to the bottom line. I've decided that I take exception to what a lot of people accept as sort of a common phrase that they use about obesity, and that is personal responsibility is what matters. Well, personal responsibility is just a hair's width away from blame. And blame is not what we need here. Blame doesn't take anyone anywhere. What we need is encouragement. Can you imagine in any other chronic disease talking about personal responsibility for that disease? It just doesn't fit. It doesn't fit if you think about obesity as a disease and not a choice. And so it's encouragement. It's the kind of encouragement we give to people who are facing cancer. And some people who face cancer can point to things that they've done that they might have worries about, but that takes you nowhere. It's all about the encouragement to overcome the condition. There's nothing that's fair about a chronic disease. There's nothing that's fair about a health condition. What's needed is that determination to rise to the challenge and overcome the health challenges that you come upon. So, what can we do about it? And I think that gets back to the theme of this whole conference of rising to the challenge. Change begins with each and every one of us. And I would say in rising to the challenge of weight bias, what's essential is, number one, reject labels. Put people first, respect others, and love yourself. We heard that last night, didn't we? Reject negative agendas and promote a positive agenda of health. Now, I want to start with rejecting labels because this is a subject that I have a great deal of passion for. Labels put people in a box. If someone labels a person as, well, they are obese, then that's an identity. Think back to when you were a child. Everybody, I know I can think of a circumstance when I was about 9 years old and somebody said, you are, and it wasn't a nice thing. And I can still remember that today. When somebody tells you who you are, they're putting you in a box. It's a label that limits, where someone is trying to limit what you are or what you can be. And I'm here to tell you that obese, as a label, is a label to reject. Obesity is a disease, it's not an identity. It's a disease, it's not a choice. And the research in weight bias has shown that in terms of blunting weight bias, when people understand the external causes of obesity, that obesity is something that is biologically determined, that it's something that is determined by environment. Yes, choices do matter, because choices are what we have to combat the unfair things that are thrown at us. But when people understand that obesity has external causes that are not under an individual's control, then they tend to reject bias. But when people are put in the frame of thinking about obesity as being a choice, then they express more bias. And this has been proven experimentally with people over and over again. It's not just an opinion, it's how humans respond to this. So it's important, and that's why I think AMA, coming late to the game of saying that obesity is a disease, is being tremendously helpful, even though it stirred up a lot of controversy and it had people arguing with it. That controversy is those people who are clinging to bias kind of going kicking and screaming into the 21st century. And so people first language is a measure of respect. I had the privilege of doing some research with Rebecca Poole and some others, looking at the differences between people who label others as obese and people who talk in terms of obesity as a disease. And people who label others as obese by standardized measures harbor more weight bias. And so when we think about what we can do about it, is shift the conversation away from being obese, obesity as an identity, toward obesity as the foe. Obesity is a common enemy, not the people who suffer with the condition. So, in summary, really, I would say that you need to keep in mind at all times the importance of respecting others and loving yourself. Surround yourself with supportive friends and loved ones, and that's absolutely essential. You saw what Dr. Kushner presented about social networks and how important they are and how important they can be. You have that social network here, face to face. You have it working. I see it on social media. Let go of mistakes and blame. They take us absolutely nowhere but down to a bad place, and you saw that in terms of the coping mechanisms that Dr. Kushner just got through described. And there are people you're going to meet, like my 104-year-old friend, who have issues and who can't get past their own issues. And they deserve respect too. Their issues maybe not so much, but you can respect people without getting sucked into their agenda. Their agenda is their problem. So I would say that as the absolute last thing I have to say, join with OAC to defeat bias. Follow Bias Busters. James and the Bias Committee are doing a fantastic job. Identify and help bring attention to stupid, disrespectful weight bias. And that's all it is. It's just stupidity brought out into the sunlight. And stupidity doesn't really survive well in sunlight. Put forward a positive message and work toward a future where we're defeating obesity and empowering those who are affected by it. Let's rise to the challenge. I think we have time for questions. And do we have the microphones up there?
Yep.
Hi, I'm Shayna, and I'm from Dallas, and I am an educator by day. I've been in public and private schools, have been in all grade levels. I'm very familiar with a lot of the anti-bullying campaigns and programs that are out there, and I was wondering if the OAC has any kind of a package or professional development material in the works to be used in schools. I found that, just from my own experience, working as a bias buster is more of a stealth kind of a thing. And when things come up, I address it with my students, but I even hear it among fellow faculty members. They'll make comments about students or about another teacher. And in that moment, it's, I can't shame that person in front of my other colleagues, so I can't really say anything right then. I feel like this is a real need for professional development in our schools. I was wondering if we have anything in the works.
So you must be a fly on the wall on some of OAC's planning sessions for the future, so stay tuned.
Okay.
Yes, ma'am.
Hi, my name is Emily. I'm from Missouri. I am a weight loss patient through meal replacement, but I also work for a physician who implements weight loss. And my question is, there are rumors that employers are going to start implementing having a certain BMI to work at a non-physically active job, just an office job or anything like that. And what's the chances that that will come about, and what are ways that we can protest that?
You're talking specifically about getting a job, employment discrimination, right?
Right.
I would say that things are looking up in that regard. Michigan has an explicit weight discrimination law that makes it unlawful in Michigan. Massachusetts is considering legislation, has been for several years. It hasn't passed yet. Some of us, I and Melinda Wattman, who is here, went to testify on behalf of that legislation. But one of the very fortunate consequences of the recent decision by AMA is that legal experts, and not just a few, the National Law Review just published an opinion piece that says increasingly discrimination against people with obesity, because it is now considered a disease, could put an employer into trouble with the Americans with Disabilities Act. It's also been a subject of interest for enforcement and successful enforcement by the EEOC. Now, most of the cases so far have been people with very severe obesity, but some employers are kind of whining about, oh my God, now we have to worry about those people with obesity. And I'm like, get over it and start treating people like human beings. But in all of that, I see good news.
Yeah, and I think that is progress, because I was at the Weight of the Nation meeting, which is a large meeting that the Center for Disease Control puts on every few years. And the first one, which I believe was 3 years ago, they brought in a legal expert, and she basically told the group, except for those with severe obesity, an employer could fire every single one of their employees with above a certain BMI, and there would be no legal ramifications or legal pursuits except in the state of Michigan. We think progress is being made in that space. I'd be curious about what her opinion is today on that same situation.
And here's a factoid to carry with you. When we went to testify in Michigan, we had the good fortune of having Rebecca Poole, who's a board member and probably the world's biggest expert on weight bias, arm us with good information. And one of the facts that really impressed me is that people assumed in Michigan that the enactment of that anti-discrimination law would result in a raft of discrimination lawsuits and actions. And in fact, quite the opposite happened. There has not been a lot of legal action based on that. But what has happened and what has changed is that there's been less gender-based discrimination complaints, because when employers had to start thinking about how I can't discriminate against people based upon their weight, then suddenly the rate at which they were discriminating against women went down, and complaints for gender-based discrimination went down in Michigan.
Ma'am.
Hi, I'm Nancy. I'm from here in Phoenix, and I'm also a teacher. And I'm a health teacher, and I came here deliberately because of that. I'm also a bariatric patient. And one of the things that I've seen in bullying and shaming, fat shaming, has to do with social media. I can't tell you how many times it appears on my Facebook, pictures of women, headless women especially, wearing clothes that are way too small, and people invited to comment. And it distresses me that my friends do, because it appears on my wall because they're commenting on it. And I will always, I've always shared it and said, why are we commenting on this? And, this is wrong. How do I, as a teacher, combat that in my classroom and combat that in the social media when, just by virtue of me sharing it, I'm kind of perpetuating it also. It's like the R word. Nobody, everybody stopped saying the R word, get rid of the R word. Why can't we get rid of the O word or the F word and not the 4-letter F word?
And I will tell you, it's a very interesting conversation. We actually use the term the O word in the OAC office at times when we work on campaigns like Your Weight Matters and others just around that topic. I think even when I do these presentations, and oftentimes I start off saying, look, I'm going to show you imagery that at times I don't find pleasant. But I think at a certain point we have to just step up and say, look, I have to show you the example. I would like you not to engage in this, and it is time. This is an example of what is bad behavior. Label it as that way and move forward. I know it exposes some risk there, because you could, look, there are times when we go after a bias issue, we give the group that engaged in that bias the publicity they wanted by doing it, okay? But the reality is it's wrong, so we go after it and we do it anyway. So, thank you. So I'm getting all kinds of waves from my staff in the back. We can take one more question and then we'll have to go. So Sarah, you're up.
Oh gosh, and I could fill a whole thing about this. But anyways, speaking of Facebook, this week I engaged in some bias busting, or trying to. But an interesting point came up. I shared it on my wall and asked friends, and I had many friends of normal size go and say they were offended, or the message wasn't being clear. But someone actually answered back and said the body shaming, even though it was obese, was actually hurting everyone, even young women who don't have a weight problem, because it's putting in their mind that it's bad. And what was shocking is people still were defending the picture. That's almost more bothersome than the original picture. Like you said, sometimes it's not intentional. So then when you speak up and try to say that's offensive for these reasons, it's, oh, you're too sensitive. Oh, stop telling people that's freedom of speech. And it's just, even so much as people might have read my story in the magazine, but the tail end of that is I was actually spoke up for myself, and I said, I was told I wouldn't get a promotion because I need to dress more professionally, and I don't think that's right. So guess what happened to me for speaking up? I was targeted and fired. So do I regret speaking up? Absolutely not. I stood up for myself even more, and it's still in the process of standing up for myself, because I had 2 degrees and there was just absolutely no way I was going to be told that I needed to dress more professionally when I was dressing better than most of the managers at the place. So, yeah.
Thanks, Sarah. We appreciate you sharing that.